Hello everyone, I am Dr. Vivek Vardhan Veerapaneni, a consultant pulmonologist and allergist at Swasa Hospital, Hyderabad. Swasa Hospital was started in 1999. Since then, we have been offering allergy asthma services to the patients of all age groups. Today in this video, we will discuss about asthma in children. Asthma is a disease that affects your lungs. Lungs are the organs that are there here, where the tubes in the lungs are supposed to be open like this. But for asthmatics, the tubes are getting blocked in this way. So the air is not able to enter properly into the lungs. So that is the problem in asthma. So coming to asthma in children, it can start at any age, starting from 1 month or 6 months or 1 year, 2, 3, at any age. Asthma can start at any age and it can persist if you don't treat it properly. People usually say children outgrow asthma. That is not the case with all children. Some children do not outgrow asthma and they continue to suffer in their later ages, when they are in teenagers, when they are in their youth, when they become elderly or adults, they do suffer, they continue to suffer. So treating asthma at the right age is very important. It is like a burden on the child. A child may not grow to his maximum physical abilities or even mental abilities if they are suffering with diseases like allergies and asthma. They do affect their growth. Suppose a patient has asthma that is severe and his age is around 1 or 2 years. He cannot play, he cannot sleep properly because every night that patient, at least in the seasons like winters or rainy season, that child may be wheezing, that child may be having breathing difficulty, cough, and he coughs a lot and finally vomits, and then probably he may sleep for a while, and again this starts early in the morning, or whenever he tries to run or play, or whenever he takes something like cold items or sour item or something like cake or sweet, whatever is triggering this asthma will not let him be at peace. So you have to recognize these symptoms and you have to consult the right doctor for good treatment, and you also have to take precautions. Patient education is the main treatment in asthma, and at Swasa we strongly believe that. So patient education, as in we tell patients not to get exposed to dust, especially indoor dust, without any protection. So you do have to take protection and try to avoid dust, especially around children. And apart from that, avoid using any strong smells or any strong smokes or any strong dust that can irritate the lungs and increase the problem. And we do tell them to avoid air fresheners or room fresheners that are having some odor that may irritate the lungs. Apart from this, avoiding cold and sour food or avoiding any food that has color. Color is a preservative that can increase your symptoms sometimes. Or avoiding some sour fruits. All these are a part of patient education. Apart from this, precautions like allergen avoidance measures, that's what I mentioned you till now, and also medicines. So to decide the medicine, we do some tests. But if the child is less than 4 years or 5 years, sometimes up to 6 years, we cannot do a test called the spirometry. So we do treat the child depending upon their or our clinical judgment, looking at their build and checking their lungs. If the lungs showing some whistling sounds or sometimes even crepitations, then we do diagnose the patient as having a wheezing illness, which can be asthma or sometimes it can be viral induced wheezing. But both of them do respond well to inhalers. So inhaler is quite safe. So some people just taken aback when you tell inhaler. So they feel inhaler is not for children and it is very unsafe for them. But it is not so. Inhalers are quite safe for children if they are given at the right dose. There are inhalers that are having very minuscule doses, but that dose is enough to go into the lungs and give you the best results. So inhalers are the right medicines even in children who are suffering with asthma, especially when they have severe wheezing or they're not able to sleep in the nights and not having a good quality of life or quality of play. Then it is a right choice, because without treatment, these children usually end up short, because asthma, it does impact your physical growth and also sometimes mental abilities. So it is better, or it is best to treat these patients at the earliest. So you have to choose the right patient and give him the right dosage of inhaler at the right time by the right doctor for the best results. At Swasa, we do treat children, adults and all age groups for asthma, with a special focus on children, because we strongly believe asthma in most of the cases starts in childhood. Asthma is a disease that starts in childhood and progresses if not treated. So at the early stages itself, we have to treat it and get the best results. So choose the right doctor and get treated well. Thank you.